Okay, well, thank you very much for having me. I was here a year ago presenting some very early findings from the work that my team had been doing around the intentions of Canadians to receive COVID vaccines. And now I'm back to report on how some of those intentions have played out. So just to provide a little bit of context before I get started. So a name that nobody had heard before 2 years ago and is now probably common language, NACI, the National Advisory Committee on Immunization. That's the national body of experts that develop the recommendations on key populations for COVID vaccination. They developed a framework to prioritize early release of vaccines and identified groups that were particularly important to target with early vaccination. And these are the 4 groups that they identified. There's no particular order to these, but as you can see, particularly the bottom 2 boxes there, individuals that contribute to maintenance of essential services and people at high risk of infection due to living and working conditions are 2 of the areas that they focused on. And that'll have relevance going forward here. So NACI also uses specific principles to guide these decision-making about vaccines. They're based on a systematic assessment of ethics, equity, feasibility, and acceptability. So we're going to dig into that equity bit a little bit. So the NACI equity criteria were developed to identify potential inequities in immunization uptake and to develop recommendations for interventions to reduce inequity and improve access. You can see here there's an explicit intention to increase access to immunization services, reduce health inequities and stigmatization, and engage marginalized and racialized groups. The term I tend to use is underserved populations when I talk about these groups. My preference is for that because I think it puts the onus on the system that's excluding people rather than putting the onus on the individuals themselves. So that's the language, sorry, should have clicked there so you could read that. That's the language I'll be using going forward. So underserved populations, these are people who face difficulty in accessing care or receive substandard care or feel unwelcome in the care they receive and because of characteristics that they hold. So these underserved populations, these are the characteristics according to Health Canada for underserved. And this presentation is going to focus on immigrant populations who often fall into these 3 populations outlined here for underserved populations. So who are we talking about when we say immigrants to Canada? So according to Stats Canada, immigrants include persons who are or who have ever been landed immigrants or permanent residents in Canada. And approximately 22% of the Canadian population consists of immigrants. 6% arrived in the past 10 years and 16% more than 10 years ago. And in terms of numbers, in 2019, there were over 300,000 immigrants in Canada. So you can see it comprises a significant proportion of our diverse Canadian population. And just out of interest, there's an indication of the top 10 countries of birth of recent immigrants according to our, I was going to say most recent census, but hopefully our new census data will be out soon. So this is a bit of a busy figure, but the point here is to show that some of the employment roles that recent immigrants to Canada hold. So approximately 65% of immigrants who arrived between 2011 and 2016 are in what they call the core age, which is 25 to 64 years of age. And a large proportion of people in that core age of 25 to 64 years are employed in industries like accommodation and food services, transportation, warehousing, etc. And many of these are what have been termed essential workers. So they're working in jobs that require them to be public facing and continues regardless of any ongoing pandemic, of course. And that has huge implications for their exposure to COVID disease. So this is to say that, you know, this is a population that is a significant proportion of the Canadian population and is providing essential service to all of Canada and are in a position where they're at high risk for COVID. So The question is, how accepting of COVID-19 vaccines are Canadian newcomers? So just before vaccines were licensed in Canada in December 2020, Stats Canada conducted a survey to identify the percentage of Canadians who were very or somewhat willing to receive a COVID vaccine. And in that study, they found that almost 75% of landed immigrants and non-permanent residents reported being willing to receive the COVID-19 vaccine. That's that right-hand bar, slightly below the Canadian-born population. And they also found that there was no difference between recent immigrants and established immigrants, and they define that as less than 10 years living in Canada versus more. Now, I think it's actually striking how high this is, given that vaccines hadn't even been licensed. Nobody knew if they were going to work or how safe they would be. So I think overall, for both Canadian-born and immigrant populations, this is impressive. So the next thing I wanted to chat briefly about is, what are the influences on whether somebody is going to get vaccinated? And, of course, I could do a whole talk on that. But what I'm presenting here is a bit of a framework that will guide the next content that I'm going to cover. So a WHO, World Health Organization expert working group on drivers of vaccination developed this model. It's called the increasing vaccination model, to establish the factors that influence vaccine uptake and pinpoint specific areas for intervention. So on the left-hand side, you have individual values and social processes that lead into the motivation to get vaccinated. And then that is influenced by practical issues like access, availability, convenience, cost, etc. And those are the factors that can either support or act as barriers to vaccination. So this was playing out, this is some of the headlines that were out there just as vaccines were rolling out, and they really speak to the motivation piece. So, we found that in the past, routine immunizations are generally well received by immigrant populations who have reported trust in the system. However, acceptance of a new vaccine, like the COVID-19 vaccine, might be particularly low due to safety concerns and lack of trust in government and public health bodies, experiences of systemic racism and discrimination, unethical research practices, and cultural insensitivities within the health system. The difficulty in finding a healthcare professional who understands one's social and cultural basis of health can also prevent people from accessing health services. And newcomers may also be unaware of the services available due to language barriers. Language barriers were a thing that came up quite a bit. Unfortunately, this lack of access to culturally sensitive healthcare and language barriers and uncertainty may push newcomers as well as others to look for vaccine information on social media. And as we know, the plethora of misinformation spread via social media and the internet can certainly discourage them from taking the vaccine. And we have seen incidents where misinformation really propagates within immigrant communities. It led to a huge measles outbreak in Minnesota a number of years ago. So those are some of the motivation related factors. Newcomers will also likely face or have faced barriers to accessing COVID-19 vaccines, including challenges due to limited transportation options, lack of flexibility in work and childcare demands, and language and literacy challenges. For instance, inflexible work schedules or having young children to care for can make it really challenging to get to an appointment. These difficulties are further compounded if someone has to rely on public transportation to reach vaccination sites. In addition, immigrants who are not as fluent in English or French may find it difficult to understand the COVID eligibility and vaccination process. Honestly, many of those who are fluent in English have found it a challenge to keep track of the changing eligibility criteria. Study done in the US last year found that immigrants are more likely to be employed in low-wage jobs that are less likely to offer paid sick leave. So they may be concerned about not just getting to the appointment, but with vaccine side effects interfering with their work. And cultural or social beliefs and practices may come into conflict with vaccination or elements of vaccination. Lack of access to proper resources may also result in people turning to less trusted sources. So here I just want to touch on some of the most recommended strategies for addressing these barriers. And depending on where you live, these have been used to more or less extent in communities across Canada. I've certainly seen them in various settings, but maybe not consistently used. Certainly, communities are often likely to trust their local providers or members within their community who they've built relationship with over time. It's been important to engage community groups or faith leaders in vaccination and use targeted, culturally competent interventions to help reduce vaccine hesitancy. The provision of reliable transportation to vaccination sites has been important, offering vaccinations at varying hours, including evenings and weekends. Using community venues has helped in reducing access barriers. Given that neighborhoods consisting of ethnic minority and low-income families are often disproportionately burdened by high COVID transmission, experts have suggested that in some instances, entire communities should be vaccinated instead of focusing on particular age groups. And we have seen that in some scenarios where there's been high outbreaks, for instance, meatpacking plants and whatnot, where they went in and did really focused immunization strategies. So that's some of the things that people have been doing or could be doing. So now let's look at some of the numbers. So how did this play out in practice? Specifically, what proportion of newcomers received the COVID-19 vaccine? Did vaccine coverage match what people had stated was their intention? So our team conducted a study. It's called the COVIM study, and it focused on both the impact of the pandemic on routine vaccines, but also on COVID vaccination. Just to remind you back to that Stats Canada survey that was done just before vaccines were licensed, they found that about 75% of immigrants and about 78% of non-immigrants were planning to get vaccinated. So here we have the data from Alberta. So our team has analyzed data from the Alberta Ministry of Health by linking provincial immunization repository data to the Provincial Immigration Registry and the Alberta Healthcare Insurance Plan Registry to identify COVID vaccine coverage for Alberta residents 12 years and older. So this analysis was done in November 2021, just before 5 to 11-year-olds were eligible for vaccination. So the focus is 12 years and older. Here you see the proportion of individuals who've received 1 or more doses of COVID vaccine as of November 2021. There's over 3 million people in that non-immigrant group on the right-hand side, and over 700,000 in the immigrant group on the left-hand side, just to give you a number of an idea of the numbers we're looking at here. So on the left, you have immigrants, specifically immigrants and refugees who migrated to Alberta between 1983 and 2020. And you see that 78%, a little over 78% were vaccinated. And on the right-hand graph, you see the non-immigrants, and you see 76% were vaccinated. So immigrants actually had slightly higher vaccination coverage than non-immigrants. And both of these are just marginally below what people had stated in the survey done by Stats Canada just before vaccines were licensed. So breaking this down a little bit, this chart shows the percentage of people vaccinated with at least 1 dose among immigrants based on time since migration compared to non-immigrants, and also broken down by age. So there's a lot going on here. So let me walk you through a few of the more interesting findings. So first of all, that light blue line, that's the non-immigrant line. That's the non-immigrant population. And the other 4 lines are immigrant populations who arrived at varying time points, which are indicated across the bottom. So just as a point of reference, the dark blue are immigrants who arrived less than 2 years previously. So this chart shows that if you are an immigrant, vaccination coverage fluctuates a bit through the younger and middle-age years, you know, sort of peaking in the middle age and then decreasing quite substantially in the older groups. So most notably in the immigrant populations, all 4 of them, the older demographic, particularly those 75 and older, have the lowest vaccination coverage. And this is strikingly different than what you see in the non-immigrants, so that light blue line, which rises up to the right there. So you see that coverage increases substantially after 65 years and is highest for those 75 years and older. And that's the group that was eligible for early vaccination. because of course, the high risk that COVID posed for them. So then also looking at time since migration, you see that more recent immigrants, that's again, that dark blue line, their coverage is the lowest at almost the lowest at that older population. So newer, older immigrants tended to be less accepting of vaccination. It's also interesting that in the young end of the spectrum, that dark blue line, so recent immigrants, the vaccination coverage is higher than all the other groups. So really interesting pattern. So newer immigrants tend to have higher vaccination coverage in the youngest ages, but the lowest vaccination coverage in the oldest ages. Now breaking that down a bit, so this is looking at just that those folks in that dark blue line, so people who migrated in the last 2 years as compared to non-immigrants. So the recent immigrants are on the left-hand bars and the non-immigrants in the right. So we're sort of looking at the two extremes here. And we're interested in seeing what characteristics are associated with uptake. So first of all, looking at biologic sex, it's interesting that there's no significant difference by sex amongst immigrants, that's the left-hand bars, whereas there has been and continues to be a significant difference amongst non-immigrants based on sex. So females have consistently had higher COVID vaccine coverage in the general Canadian population, but not so in immigrant populations. When you break it down by income, similarly, you don't see a significant difference in vaccine coverage in newcomers based on neighborhood income quintile. So that's the left-hand line. You see those numbers are very similar and the confidence intervals overlap. But in the right-hand group, you see a significant gradient by neighborhood income amongst non-immigrants, where you see lower coverage with lower income. For urban and rural status, this looks a little bit different. So newcomers in rural areas, so that's the gray bar on the left there, they are the least likely to get vaccinated, whereas newcomers in urban or large metro areas, the orange and blue bars, have higher coverage. When you compare it to non-immigrants on the right-hand side, we see immigrants had higher coverage in urban and metro areas, but lower in rural areas. So this finding, is supported by some findings from a systematic review that looked at some barriers to immunization amongst newcomers, and they found that newcomers do tend to face barriers related to access that are exacerbated by living in rural areas compared to urban. So just as I finish up, I just wanted to highlight this fact again, that COVID vaccines were licensed for kids 5 to 11 in late November in Canada. And so certainly there's the need for future work to focus on that group. When we look at, how that might play out, previous studies have shown that children of immigrants have comparable or slightly lower uptake of routine immunizations compared to non-immigrant children. However, the data from our study has shown higher COVID-19 vaccine coverage in the younger demographic amongst immigrants. So that's really encouraging. So it'll be important for us moving forward to address the known barriers to uptake in this particular underserved populations and ensure that this group is able to access the vaccine, because vaccinating that 5 to 11-year-old group, it has the potential to really lift our overall coverage rates and of course protect the whole community. And I'll just close by thanking my team who supported me in this work. I am proud of the fact that I have a really diverse and inclusive team, and I always try to include representation of the communities that we're studying within my research group. So I thank the students and analysts that worked with me on this work.